What is Pcos? Pcos is Polycystic Ovary Syndrome. What is the definition of Pcos? Definition of Pcos is the disease involving hormonal disorder common among women of reproductive age. Women with Pcos may have infrequent or prolonged menstrual period or excess male hormone. The ovary may develop numerous small collections of fluid follicles and fail to regularly release egg. Polycystic ovaries. This is the image of polycystic ovaries. The left one shows normal ovary while the right one shows polycystic ovaries. As you can see, the ovaries in the right one, which is the polycystic ovary, show enlarged and contain follicles that surround the eggs. The ovaries might fail to function regularly. There are 3 symptoms in polycystic ovary syndrome. The first one is obesity. What is obesity? Obesity is the complex disorder involving excessive amount of body fat that may cause several health problems, including Pcos. The second one is excessive of androgen. The elevated level of male hormone may result in physical signs such as excess facial and body hair, and occasionally severe acne and male pattern baldness. The ovaries produce abnormally high level of androgen, resulting in hirsutism and acne. As you can see in this image, this girl are having hirsutism, which she has very hairs in her face and her body with acne too. The third one is irregular periods. What is irregular periods? Irregular periods is infrequent, irregular and or prolonged menstrual cycles are the most common sign of Pcos.
Next, we move to the causes of polycystic ovary syndrome. The first one is excess insulin. What is insulin? Insulin is the hormone produced in the pancreas that allows cells to use sugar in the body's primary supply. The second one is low-grade inflammation, which is the body cell's production of substance to fight infection. Women with Pcos have a type of low-graded inflammation that stimulates polycystic ovary to produce androgen, which can lead to heart and blood vessel problems. The last one is heredity. Certain genes might be linked to Pcos. Next is complication. The
First one is infertility. Infertility is not being able to pregnant. The second is pregnancy-induced high blood pressure. The development of high blood pressure during pregnancy is known as preeclampsia. Women with preeclampsia were more likely to give birth to underweight babies and deliver prematurely. The third one is gestational diabetes. Pregnancy-related diabetes is called gestational diabetes. Women with gestational diabetes were more likely to deliver underweight baby. The fourth complication is metabolic syndrome. Metabolic syndrome is a cluster of conditions including high blood pressure, high blood sugar, and abnormal cholesterol or triglyceride level that significantly increase your risk of cardiovascular disease. Next is depression and anxiety. Then, miscarriage. Miscarriage is defined as spontaneous abortion, and pregnancy loss is the natural death of an embryo or fetus before it is able to survive indefinitely. Then is endometrial cancer. Endometrial cancer is a cancer of endometrium, which is the lining of uterus. This is the endometrial cancer. Next is non-alcoholic steatohepatitis. It is a severe liver inflammation caused by fat accumulation in the liver. Then, sleep apnea. Sleep apnea is a potentially serious sleep disorder which breathing repeatedly stop and start. Lastly is abnormal uterine bleeding. It is a bleeding between monthly period, prolonged bleeding, or an extremely heavy flow.
Next, the treatment for Pcos. The first one is progestin therapy. Taking progestin for 10 to 14 days every 2 to months can regulate the periods and protect against endometrial cancer. The second one is by consuming combination birth control pills. Pills that contain estrogen and progestin decrease androgen production and regulate estrogen.
Lastly, for the prevention of Pcos, firstly, you have to exercise and be active. Exercise will help lower blood sugar levels and keep weight under control and prevent diabetes. The second one, you should limit the consuming of carbohydrate. Low-fat, high-carbohydrate diet might increase insulin level. And the last one, you have to maintain a healthy weight. Weight loss can reduce insulin and androgen level and may restore ovulation. That's all from us. I am Zuridah binti Ghazali.
I am Nurul Izzah binti Abdul Majid.
I am Aida Dalilah binti Jamaludin.
Thank you for watching our videos.
Bye!